Welcome to Prisma Health Surgical Oncology. This video will help educate you on an endoscopy procedure. Our office building is located at 2 Medical Park on the Richland Hospital campus. After filling out paperwork and signing in, you will be taken back to an exam room where a nurse will take your vitals and review your symptoms. You will then be seen by Dr. Mariangela Rivera to initiate the endoscopy.
Hello.
Hi.
I'm Dr. Rivera. It's nice to meet you.
Nice to meet you too.
So, what brings you in to see us today?
I've actually had some irritation in the bottom of my throat. It feels like something's stuck and it's hard to catch my breath.
Okay. Well, what I think we can do today is do an exam. We'll take a feel of everything, take a look back there, but I think we should put a camera down and take a look at your vocal cords and at the anatomy. So what we'll need to do is get your nose numb so that you're not feeling too much when I put the camera down. And while you're doing that, I'll just go set up my little gadget, okay? All right. So just take this, put a couple of sprays in each nostril. And before we get started, is it okay if I take a quick feel of your neck?
Yes.
All right, just look straight ahead. And I'm just taking a feel for lymph nodes. This all feels perfectly normal. And there's a little bit of crunching in your voice box. That is also totally normal. All right, not too bad, right? Okay, let's go ahead and put our camera down. So this little guy, real tiny, you can see it moves and wiggles, and so we're just gonna take a quick look inside your nose, okay?
Okay.
Deep breath through your nose. Stick your tongue out as far as it'll go. This looks wonderful. Okay, go say head and say E. Deep breath in, and E. Great, all right. That's about it. I'm coming out. Yeah. Easy peasy. You did awesome.
Thanks.
So, just a little recap. This is the inside of your nose. Looks stone cold normal. I don't see any deviation or any abnormalities. I'm just going to pause here and come back. So this is, we went through it really quickly, but this is your eustachian tube orifice. This is where your ear kind of drains into the back of your throat. When you pop your ears, that's what you're feeling and hearing back there. Okay. This is the nasopharynx, or the back of the nose and throat. It also looks perfect. We had you take a nice big deep breath, and here you can see the soft palate. This is that dingle-dangle in the back of your throat. Looks totally normal. And then as we come back here, we spend a little bit of extra time on the back of the tongue, because that's where cancers are most commonly going to occur, and they look perfect. Okay, and then back here we have your vocal cords. You can see these 2 bright white lines. These are your true vocal cords, these are your false cords, and then this space in between is where we sometimes see a little bit of irritation in patients who have reflux. That doesn't look too bad. And then down here in your windpipe, you can see that all looks perfect, and your vocal cords are opening and closing evenly and symmetrically. That little petal there is your epiglottis, same thing, looks normal.
Okay.
Okay, just let me show you real quick on the model so that you can kind of see what I'm talking about. So if we look over here, I've got this guy's head kind of cut in half, and what we're looking at is the cross-section of the nose. These are the sinuses. This is that soft palate again. The area that we were concerned about was back here on the arytenoid cartilages. This is actually the epiglottis there, and then there's the arytenoids at number 21. That was just a little bit more irritated. So I think what we talked about, I think we just need to make a little bit of medication changes, and then we'll have you back in about 6 weeks and go over everything again and see if there's been any change, okay? All right, let Kamari know to check you out and have you back in 6 weeks.
Thank you.
Thank you.
Thank you for watching our video. Please call Prisma Health Surgical Oncology at 803-434-8800 with any questions or to speak to your primary care provider.